Welcome back. Nearly 14 million people live with a serious mental illness such as major depression, schizophrenia, bipolar disorder. Mental health is an important part of your overall health, and that's why May is designated as Mental Health Awareness Month. Joining us today, Ranus, Executive Director of the Austin chapter of NAMI, the National Alliance on Mental Illness. Thank you so much for joining me, Karen.
Thank you.
So let's start up by talking about NAMI Austin. There's several events going on this month that are open to the public, and the whole point is to raise awareness.
Absolutely. All of our events are really about educating the community about mental health. So often there's a disconnect between mental health and physical health, but the reality is those go hand in hand, right? They're both really important. And what we're trying to do is educate the community about some important facts, including the fact that it's very common. 1 in 4 people will face a mental health diagnosis in this year. So that's quite a bit of numbers. The other is that really that mental illnesses are treatable, that the right treatment and health care and access to all of the supports do make a difference.
Now, you were telling me in the break, early intervention as far as early prevention, that is key. And mental illness, you're right, is a very real and common thing. Personally, tell me about your personal story with your daughter.
Yeah, about 3 years ago, we faced a crisis with her where we found ourselves at a mental health hospital having her admitted. And that came as a huge surprise to us because she had really hidden her major depression and her eating disorder really well. What really helped us is to gain access to the resources in the community. NAMI Austin was huge in that because they offer classes and support groups at no cost to the community. So we were able to educate ourselves on what it was that she was facing and how to advocate for her, and it made a huge difference.
2 things. Kudos to you for actually noticing the signs and actually doing something about it and helping her out. And how's she doing?
She's doing fabulous.
Awesome.
She's back in school, fully in recovery from her major depression and her eating disorder. So treatment does work. Recovery is possible.
You're proof right there, and your daughter is proof. But what are the main goals of NAMI is to stop the stigma related to mental illnesses so that people can kind of come out of the shadows and say, hey, I know someone, you know, it's very common. So how do we stop the stigma?
Well, one of the main ways is to really talk about it and really educate ourselves on the fact that it is so very common. One of the things that keeps people from getting the help is really that there's this sense that if you have a mental illness, it's a flaw in character, it's a personal weakness. So we really educate the community that mental illnesses are like physical illnesses. People aren't to blame for their mental illnesses. And when we talk to each other and help one another and reach out for one another, that really does make a difference in ending the stigma.
There are events tonight and tomorrow night, and I know we have that information on our website, but what's your website as well, just in case?
It's namiaustin.org.
Okay, very important. This is a very important topic.
It really is.
Thank you so much for coming in. And here's one of the events that's taking place, I believe. Is this one tonight?
This is tonight, and it's on assisted outpatient treatment, and so that's a big one that there's a lot of conversations going on about.
And tomorrow at Vista Ridge High School at 6:30.
And that's open to the public.
Awesome. Thank you so much for coming in.
Thank you.
Brian, over to you.
Yvonne, thanks.